I first realized that something was going wrong and something was wrong when I was about 16 years old. When I was a teenager and I was in high school, and I started to withdraw from my friends, and I started to get suspicious of people, and I started to see lights coming from people's eyes. I didn't know it was called schizophrenia because we didn't have much education on it. But I recognized there was a problem, and I hoped I would get better and go on to university and the problem would go away. I would estimate in my life I've been hospitalized over 25 times, particularly before I found a medication that helped deal with the illness. Some of the early hospitalizations probably were what's called a revolving door, because I would feel so bad at home. The sense of well-being was so bad and so depressed and so anxious that I wanted something to change, and the only route I knew of was the emergency department. One time when I really fell through the cracks, I'd been in the hospital, and after 2 days, they discharged me and they gave me 2 bus tickets, and they said, this is the way to the shelter, it's downtown. And I took the 2 bus tickets and I went downtown, and I was completely disorganized, and I was thinking that the cars were going to come and follow me, and I walked into a restaurant and they gave me a sandwich and they said, you should really try to get to your family. So I took a bus ticket, and I took a bus, and I went up to my cousin, and I went into their house, and they gave me some shoes because I hadn't been wearing shoes, and they gave me a meal, and my aunt said to her son, please take him in the car and take him back to the hospital because he needs to be in there. So if there had been a clinic where I could have walked in and they could have advised me on ways to change the medication, higher support, without having to go to emergency, that might have made the difference. And really, in terms of mental health treatment, it is a new era. We have new emphasis on client-driven, client-centered care, newer medications, newer models of treatment, better hospitals, and I think overall a really stronger commitment from our society to help people with mental illness. Because as I say, it's not something that affects somebody else, it affects us. So I think the commitment that our society has is going to mean a lot brighter picture for somebody in the future.